The study is part of an exploration of a novel treatment for the management of mitral regurgitation in people who are not suitable for surgery. Mitral regurgitation is a very prognostically important disease, and patients who are not eligible for surgery have a very poor outlook. So we've been exploring an approach to treating them using a novel approach of implanting a device through the apex on a beating heart that we believe will be suitable for patients who are not surgically eligible. This is a device that's a self-expanding device. It actually consists of two frames. The outer frame is variable in size and fits the annulus, because the mitral annulus is very variable in size and shape. And it has a central inner frame that holds the valve itself. The valve is made of porcine pericardial tissue, so it's a bioprosthesis. And the device is implanted from the apex. It expands as the sheath is withdrawn and then is pulled down into the annulus and tethered there. It's actually held in place by a tether attached to a disc at the apex. So unlike a few other devices that have been used for this same treatment, this is not actually physically attached to the annulus at all. It's held in place by the tether, and that has some unique advantages, I think. The annulus can be anything up to 45 millimeters in diameter or so. So it goes in through a device which is about 34 French, so that's quite a big device put in through the annulus, but as it comes out of the device, it expands into something which has quite a large flange around the outside that lies on the floor of the annulus, and then the device itself sits in the annulus and occludes the regurgitant flow. So it's a big expansion. It does change conformation a lot as it expands. So these patients are all by definition not surgically eligible or very poor candidates. They usually have significantly impaired left ventricular function. Most of them to date have been patients who've had heart attacks or previous bypass surgery, so they have an ischemic myopathy as the basis for their enlargement and left ventricular dysfunction. Most of them are somewhat younger than, say, the TAVI population, who are typically in their 80s. These patients are typically in their 70s, average age of about 77 in this population. And they often have other comorbidities that make them poor candidates for surgery. So we'll be presenting at this meeting the 30-day results of the first part of the patient cohort. There's a larger cohort that will be presented in Paris in May at the EuroPCR meeting. But this cohort will have fully audited 30-day outcomes. And in essence, we've been delighted with the results. There have been no procedural deaths, no deaths by day 30. There have been no strokes. There's been no need to remove the device surgically. And patients are all actually doing remarkably well. Traditionally, this is a population of patients that have just not been treated at all, really. They've been treated medically, and they do fairly poorly. And I think we now have a device and a procedure that we're reasonably confident can be placed predictably with a good result. And time will tell, I guess, whether it really does make a big difference to the long-term outcomes of these patients. But certainly clinically in the intermediate term, from a symptomatic point of view, patients who are desperately sick are now doing very well. So I think my message would be you should think about this as an alternative. The results are really much better than we had anticipated. So we've almost completed the early feasibility trial, which has been a trial of a number of sites in the US and in Australia, and one site in Norway. We're about to start the expanded trial, which is to include more sites and up to 110 patients. And our hope would be that over the next 12 months that will be completed, which would allow CE mark approval and then commercial use of the device. But one of the interesting things about this is here in the US there will be multiple sites. It's often taken a long time to get US sites up and running with these sort of very early phase developments, but the US will be contributing largely to this trial.